What is autism spectrum disorder? Autism is not black and white, far from it. Although there are ways to describe this disorder of the mind, it truly can vary from person to person and create a diverse spectrum of symptoms and characteristics, hence its name. However, the real question is, how exactly does this disorder manifest and how can it affect a person? There are three basic symptoms observed in all types of autism: social interaction challenges, deviant responsiveness and difficulty in communication and cognitive dysfunction, and insensitivity or oversensitivity to certain stimuli, including sight, hearing, smell, taste, and touch. Tendencies to engage in repetitive behavior is also prevalent in some cases of autism and can involve pacing, head rocking, and hand flipping. Some with autism can be verbal, others nonverbal. Some have difficulties predicting others and their own behaviors or emotions based on their thoughts and feelings. Cognitive strengths and weaknesses vary from individual to individual, and these are only some of the varying symptoms along the autism spectrum. Like many disabilities, heavy stigma and discrimination can be seen with people towards the autistic community. So how has history treated autistic people, and how can this discrimination still be found in our society today? Research published in 2013 reported the results of a survey taken of a national sample of American parents of autism spectrum disorder conducted by the Kennedy Krieger Institute. The study found that 38% of autistic children experienced bullying over a 1-month period, and 28% were found to be frequently bullied. Of these, 69% experienced emotional trauma, 14% feared for their safety, and 8% suffered physical injury. The concept of autism was coined in 1911 by the German psychiatrist Eugene Bleuler to describe a symptom of the most severe cases of schizophrenia, a concept he also had created. Then, from the mid-1960s onwards, child psychologists used the word autism to describe the exact opposite of what it had meant up until that time. Whereas autism in the 1950s reserved to excessive hallucinations and fantasy in infants, autism in the 1970s referred to a complete lack of unconscious symbolic life. Truly, this was a disorder that was so thoroughly misunderstood. In the 1960s, children with developmental problems received horrific institutional residential care, and many are still kept there up to this day. Stigmatized people, such as those with disabilities and mental illness, are often seen as incompetent, blamed for their suffering, and socially marginalized in ways that we might now consider as ableist. Autistic people have experienced this for the past century, if not more. Children with autism were often diagnosed with childhood schizophrenia or mental retardation, and schools and employers offered few opportunities. Today, there is more discussion on this mental disability and more being open to discuss their own struggles with it. So, what do people with autism have to say about autism?
I would feel like that too. Absolutely. Yeah. That's tough.
I think about it every single day. That's why I remember it like it was yesterday. And I thought there was nothing wrong with me, and then when I switched schools and they still bullied me at the other school, I was like, there's something wrong with me now. What's wrong with me? I was almost 14 years old when they found out.
Yeah.
They had been testing me for ADD and it kept coming out negative.
Mm-hmm.
And all I remember as a kid was they kept pulling me out of classes to test me on stuff. And I'm like, why are they doing this to me?
Yeah.
I personally wasn't cognitive about it until like I was much later into my life, probably like around 14 to 15, when I was able to actually understand that I'm autistic or I have autism. But in terms of like parental and family, I didn't speak till I was 4. I went to doctors and all that kind of stuff, and they told them that I was diagnosed with autism.
Can you explain what the sensory sensitivities with autism are?
For me, it's mostly sounds, like not loud noises, but someone talking on the phone in the room next to me, or the dog barking up the street, or maybe my neighbor is hammering a table or something.
So it's less like physical sensory stuff, it's more just like a mental, like you're fixating on certain details?
Yeah, exactly, that too.
Do you go through life proud of your autism, or do you kind of keep it more of a secret?
I mean, I guess, well, for me personally, because I'm higher functioning, actually most people won't even recognize me that I'm on the spectrum. I remember when I first was coming out on Facebook, a lot of the comments I would get, they were saying, I never knew, but I'm so great to hear your story, and it's like inspiring to see like those hurdles that you went through. I would never have believed you, because it's an invisible disorder. So it's really hard to tell unless you're actually like get to know the person.
How do you think people without autism should interact with people who are on the spectrum?
Treat us normally. Using normal, I'm sorry. Treat us like
Like you would anyone else?
Yeah, pretty much. Like, treat us like how you would treat anyone else. Be aware that the fact that we do have a mental disability, that we do have autism, but don't be changing the way you speak, the way you act.
In keeping the needs of autistic people in mind, what accommodations can be made to better aid them in their lives? Well, not all adults on the spectrum are capable or ready to live independently. It depends on the individual's level of independence and needs for support, as well as what is affordable, given any government benefits that may be available and the family's financial resources. Behavioral educational interventions, behavioral analysis, complementary and alternative medicine, dietary and medicine changes, or medications to manage or relieve symptoms of autism are only some of the medical needs that those on the spectrum may need. Some options for those on the spectrum include staying at home with parents or other relatives, adult foster care, institutions or developmental centers, group homes or community-based houses, supported living, which includes having check-ins and help with tasks of daily living. According to the CDC, the average medical expenditures of a child with ASD exceed those without by $4,110 to $6,200 per year. To prevent what happened in the past from occurring today, long-term ways we can institute justice need to be implemented. An autistic person should be treated with the same dignity and respect as another person, in accordance with the Catholic social teaching of dignity of a human person. Only 16% of autistic adults are in full-time work, despite 77% of those unemployed wanting to work. The common good requires that individuals and societies respect the basic inalienable rights of each human being and promote the social well-being and development of various social groups. Therefore, simply because someone doesn't look the same or act the same doesn't mean they aren't human or do not have feelings. Treat others the way that you would want to be treated.